Brandy Schrenker. I'm a registered dietitian, diabetes clinician here at Integrated Health Concepts. Just to tell you a little bit about my background, I've been a dietitian and diabetes clinician for I guess close to 20 years now. So I know a little bit about diabetes. I used to work at a diabetes treatment center at the hospital, and I would just basically show up and throw up and teach like a 9-hour class and then say, okay, you got it, good, go. And then I would never see those people again. And so in that atmosphere, in that climate, I never saw people get better. You know, it was a group class, but it wasn't the community that I think that we need, like the Blue Zone that Victoria is going to talk to you about. And I'm totally on board with that because I feel like Dr. Mabry said earlier, we're at the bottom, so obviously we're not doing something right. You know, I talk to patients about diet all day long. I do a lot of things here. Here the difference is, you know, we talk about reversing diabetes, not just managing diabetes. We know that it can be done. We know that, you know, that our diet has a lot to do with that, but it's not just about the diet. It's about all the other principles that the Blue Zone can offer us here in Tennessee and Southwest Virginia. So I'm going to jump right into my presentation. Vicki sent an email and said, Brandy, I want you to talk about nutrition, health, and the real cost of eating well. So there it is. That's what we're doing. So I just kind of put this together, but not a whole lot of time spent on it, but I did want to just address some things. You know, when we talk about food insecurity, when I was growing up, this is kind of what I thought, you know. We thought about malnutrition. We thought about, you know, people that didn't have food. So that was kind of that mindset that I had when I was younger. And then if we look at now what that means in our area, food insecurity, if you can see my slide, it's not having reliable access to enough affordable nutritious food to live a healthy life. And that may be because of, you know, access to good quality food. It might not just be about hunger. It might be the fact that people have to choose between eating processed food or paying bills, you know. So I think, especially, you know, in rural areas, we have a lot of kids that unfortunately are becoming type 2 diabetic. I mean, when I was in school, I don't remember or recalling anybody having type 2 diabetes as a kid or a food allergy. You know, we had one girl that was would have been considered overweight, but she was pregnant, and that was why that was that. So you know, so you just didn't see it. It wasn't as common, and I'm not really that old, but it just wasn't as common. Unfortunately, we're seeing a lot of kids now that are overweight, but they're still malnourished because they're not getting the nutrients that their body needs. They're relying on this packaged food. And so I really am excited about, you know, how we can maybe reach some of these people. I'm fortunate enough to be here at Integrated Health Concepts, but, you know, it's kind of a problem in a way because people seek us to be healthy. You know, people come here because they know that we're not going to push medications. We're not going to push, you know, 15 pharmaceutical drugs. So we're missing a big target audience. And so that's what I want to talk about today is how can we possibly increase our access to these people by offering these classes, these hands-on nutrition classes, you know, for free if they need to. And they don't have to jump through hoops to get there. If they want to come and they, you know, have diabetes or obesity or whatever it may be, they're not going to be turned away. They should have access to these classes that we're going to talk about. All right, so if we look at the Supplemental Nutrition Assistance Program, this is called SNAP, and some of you might be familiar with what this is, but it's basically food assistance. There's 40 million people in the United States on food assistance. The Trump administration, you know, there's going to be a lot of budget cuts, and it's going to, you know, it's going to trickle down. You know, people will either see their benefits reduced or maybe even completely eliminated based on, you know, if they work or I think they're even going to start requiring people to work like 20 hours a week. Well, if you're a mother with 5 kids, you may not be able to do that. So we're going to start seeing some issues with that. But right now, you know, you could spend a lot of your nutrition or your SNAP money on processed foods, sodas, energy drinks, all of those things. So the Trump administration last week allowed more states to stop people from buying these foods and beverages. Now, Tennessee isn't one of them, but I feel like if we're going to bring in the Blue Zone Project, then hopefully they will be the ones that will help champion this, because I do think we do need to get rid of it. I mean, not saying that you can't buy it if you want to buy it, but I don't know that taxpayer money needs to go towards these foods because we know where we're at with our health, right?
The state passed that, Brandy.
They passed it?
In the state legislation.
Oh, I didn't know that. As of when?
Tim told me that last month.
Okay. Well, in Tennessee?
Yep.
Well, I wonder when it'll come into effect. Okay. Well, good. Okay. Well, that would be fabulous. So again, you know, right now it does allow for the ultra processed foods. It's a social currency for teenagers. You know, this was amazing to me. I was reading an article on NPR the other day, and you know, they were talking. This mom was saying how it's going to really impact her family, and her teenager would not be able to buy her Red Bulls to take them to school because everybody, because you know, Starbucks, they can bring Starbucks in, and of course SNAP benefits doesn't cover Starbucks, but at least if they can bring in a Red Bull, they fit in, you know. So that just is just remarkable to me. Yeah, it was really shocking to me. I was really shocked. So if we look at what is spent on processed food, about $780 billion a year is spent on fast food and processed foods. That, you know, again, ultra processed foods are your sodas, your chips, your white bread. 50% of our calories consumed are on processed foods. So you could see we've got a lot of work to do, and how do we fix that? And I think I have a few ideas. So why is it cheaper? That was Vicky's other question. So why is it cheaper to eat processed than to get real food, what we call whole food? Processed food is highly subsidized, okay? In the U.S. and many countries, they subsidize corn, soy, wheat, and those lower the cost of those foods. So you're lowering the cost of your chips and your sodas and your white bread. It's a long shelf life. So if you go to the grocery store and you buy, you know, ramen noodles, snack cakes, Little Debbie's, you know, if you ever seen a Twinkie, it could be 10 years old and it still looks brand new, okay? So that's because there's 100 chemicals in it. So, you know, it does offer a longer shelf life. And if you look at calorie per dollar, a $1 burger is more calorie dense than fruits and vegetables, you know? So I guess you're getting more for your buck if you're doing that. So on the flip side, fresh produce, it spoils more quickly. So, you know, maybe people aren't buying a lot of fresh produce. They have to go to the grocery store more often. There's higher upfront costs. So buying a bag of spinach and some quinoa and olive oil, I always like to say, you know, you can make a big batch of that and you could eat it 3 or 4 days. But evidently, fast food is still cheaper in the long run when you do that. The other thing that's really important is healthy food often requires food prep. It requires cooking skills. Who's getting cooking skills in school anymore? Nobody, right? I mean, unless you take a culinary class, you are not getting the skills that you need. Home ec is no longer in schools. Nutrition isn't really taught in schools. So kids are getting out. I mean, I just had my son's girlfriend came and chopped vegetables for me today. She's never chopped a vegetable. She's never opened a can of beans, you know, and so we're missing that. And so I think school is where we need to try to get back to doing some of this if we're going to make some positive changes. But here's the twist. So over time, eating nutritious food is often cheaper in terms of health, okay? So chronic diseases like diabetes, heart disease, obesity are all linked to poor diets, right? And they come along with big medical bills. So yes, it is cheaper to eat in the short term, but if you can invest in these foods and care about what you're putting in your body, hopefully you're going to be on less medication, right? And you're going to have less ER visits. So what are some of the challenges? I could go on and on, but I'm not going to about this. But, there's a lot of information out there, right, on nutrition. It's conflicting. As a dietitian, I have patients that come to me and they say, well, my doctor put me on a keto. My doctor put me on low carb. My doctor put me on, vegetarian. I'm supposed to be Mediterranean. So there's so much information out there and so much conflicting information that we don't know what to do, right? And again, do diets work? Why are we pushing diets? Because diets really are not sustainable. I will say, there is, sometimes reasons for strict diets. My son, Austin, was diagnosed with epilepsy back in 2020, and the neurologist put him on a keto diet, and when patients come in to me and say, I'm on keto, I'm always, really, are you sure about that? Because if you look at a keto diet, it's very, very strict, and 75% of your calories are coming from fat. And so I was very diligent when he was first diagnosed with epilepsy, and I made sure, he didn't have any sugar in his diet. He was eating totally 75% coming from the fat, and he felt awful. He felt awful. You can attest to that, right? He was, so it lasted for, a couple of months. And then I was finally like, we've got to do something. This isn't practical. So you have to be careful too when you're recommending these diets, because again, you want to set people up for success and not failure. And I think we need to maybe get kind of away from putting people on diets and more of, I think we can all agree, eat more plant foods, right? Or we can eat more fiber in our diet, and kind of go about it that way. Also, there's, strict medical nutrition therapy. That's what that means, MNT guidelines. I have another dietitian here in the audience, Monique, and I talk about this a lot. We don't get paid to do this. And it's frustrating because there's so many stipulations that even if we did get reimbursed, it wouldn't be worth it, because at this point in time, it only covers type 2 diabetes, chronic kidney failure, and heart disease. They're trying to pass another expanded medical nutrition therapy act to also include obesity and some gastrointestinal issues, celiac disease, cancer, things like that, but we're just not there yet. And then also, a nurse practitioner can't refer to us. Only doctors can refer to us. So it gets a little crazy. And the problem with that is that you can send us patients all day long, but they don't see the value in it because they have to pay for it out of pocket. So I would love to just get rid of that altogether, where they don't have to worry about that. But that's been kind of the struggle, is just, getting people to invest in nutrition counseling. Stress, emotional eating. So there's a lack of mental health counseling. A lot of patients will come to me and say, I'm an emotional eater. I stress eat. I'm not a psychologist, but I do feel like sometimes some counseling could help with that. Then, you have around here a lot of social gatherings, right? So we've got everything, that comes with food, church gatherings, weddings, there's always, and we have to take that into consideration. That's our culture around here. And funerals, exactly, and funerals. And so then, again, the bottom, is always like, it's too expensive, right? It's too expensive. So if we look at the Dollar General stores, the Dollar General, they put their stores in these small towns and rural markets. So we have a lot of Dollar Generals in our area, right? But they started putting fresh produce and meat in their stores around 2003. So it is possible to buy healthier options. We have a grocery store, a Dollar General on my way home. And so I walked in there the other day and I took some pictures, but you can see this is not the way it used to look. It was a very convenience, go in, grab and go type place. So now we see some, fresh fruits and vegetables, some cases of produce there, which was good. And then I also, tried to compare prices. I was like, if I wanted to come here and get something, sardines, they're healthy. They've got some good omega-3s in them. $1.25 a can. That's not that expensive. Salsa, $3. olives, all these things that we recommend on the Mediterranean diet, nuts, again, not very expensive. But if we look at what you see when you first walk in, this is what we see. It's everywhere. It's the candy, it's everywhere where the kids can run up and get. They don't put it up here, they put it down here. And so, we're fighting against this because they're putting all of these artificial colors and ingredients and chemicals and everything in our food. And, how do you tell a kid you don't need that or you can't have that because it looks so fun, right? So if we compare, if somebody wanted to get a bag of chips, $4.50 for a bag of Doritos, $3.50 for some popcorn. You're getting fiber there. It's $1 cheaper. Beans, again, great source of fiber. I promote beans all the time. I have some here tonight. Everybody should be getting a little serving or 2 servings of beans a day. It's a great source of fiber, great source of protein, cheap, so it's really, really inexpensive to get the beans in your diet. If we look at bread, even, I was looking at 100% whole wheat bread versus the Wonder ultra processed. The whole wheat was $1.95 versus $3.95. So I think, the biggest thing is there needs to be a shift in our mindset. We need to try to get people to understand that, good health is an investment. It's, we want to invest in our food, invest in local farmers, invest in our community over prescription drugs and hospitals and things like that. We need to make people understand processed food is addictive. It's like nicotine, right? So, again, when we look at where we were when we were watching, what were we watching the other day? The Beverly Hillbillies. Yeah. And they were smoking at the table and they were doing their Winston is the best,
It's good like a cigarette.
Right. And so I hope that we can get to that point because now you look at it, you're like, oh my gosh, they really, but I hope we can get to the point that we can, really start to get people to understand that, it is addictive. They put things in there to make it addictive. We know that. There's not a lot of food studies. If there would be a lot of money to be made, but they don't do that because guess what? Food research is not going to make a lot of money, right? So they don't want you to know how addictive these foods are. So know better, do better. There's lots of apps available now that I love, that I really push to my patients to try to download. The Yuka app. Is anybody familiar with the Yuka app? Love it. And we'll look at that just a second. So, again, we talk about all of this. I think Dr. Mabry has his own slide when it comes to the pillars of health, functional medicine. We know what, we need in order to prevent disease, right? We know we have to have all of these things. We know we have to watch the stress. We know we have to have better sleep. And I talk to my patients about these things. But the thing I think is a little bit different from where we are here is that we can say, go downstairs and have some breath work. Go and have some acupuncture or massage. So, it's all kind of a one-stop shop when you have those services available. Let's see. Access to health, water's free, so you could drink water instead of soda. Walking is free, so that's pretty easy to do. Getting out and connecting with nature, that's free. And then the Yuka app is free. And I want, do you mind, Tracy, to come up and show? I just want to show you guys just this was just on the Today Show. Did you see it, Dr. Mabry? Okay, just a 2-minute video here.
Ingredients in your favorite chips or soda or dessert really mean?
My favorite chips are good. Uh-oh. It's all 0 out of 100.
This actually got a 78 out of 100. Excellent.
Some consumers are scanning their way to answers, turning to apps to decode ingredients and nutritional facts. So we enlisted some help to see for ourselves.
I'm here with registered dietitian Perry Klingbaum, and she's going to show me how to use these apps. You ready? Let's go. Okay.
First up, Yuka, a top health and fitness app that scores foods based on nutritional quality, additives, and whether they're organic. We started with eggs.
The Yuka app says 90 out of 100, it gives you results. Excellent. High in protein, low in calories.
And we tried Brandy's mac and cheese, which flagged 3 additives over potential health risks.
Very do you like is that the Yuka app tells people about additives? I feel it's very educational. You can go in and click and it gives you more information about what that additive is and what you might be at risk for, and you can determine if that's something that's applicable to you or not.
Next up, Bobby Approved from food influencer Bobby Parrish. This app focuses on sugar, oils, and colors, as well as whether products are organic. Something it pointed out with these eggs.
They're saying it should be non-GMO, organic, or ideally pasture-raised.
The app approved this Kerrygold cheddar cheese.
Grass-fed, pasteurized milk, salt, cheese cultures, and enzymes. 4 ingredients. So this is pretty simple. And even right here, it says 100% natural.
Finally, we used Zoe, which notes nutritional quality and the amount that a food is processed. Zoe gave the eggs a high rating.
This got a food score of 80. Enjoy regularly, no risk of processed foods on the Zoe app. What say you? It's analyzing the nutrition information, the additives, the protein, calories, fat, carbs, and I think that eggs are a real whole food, and that's what the app is reflecting.
So that's basically it.
Your meal and
If you get that. I mean, so you can see there, we're coming a long way with these apps that, I think it is powerful. Who doesn't have an iPhone? I see 10-year-olds, with a lot of devices that you're like, how do you have the newest iPhone? So I do think, we could use this to our advantage, when we're talking to patients. It's just a great way. It makes you think twice. I scan everything when I go to the grocery store, and that's why I have these things out. When I was looking at chips to put out today, I was scanning, and you wouldn't believe it was like bad, bad, bad. Those are actually good, the ones that we have today. So, it is educational, and it's something that, everybody has a phone, right? Everybody has a phone. So it's a really easy way to get a snapshot of what's in your food. So what can we do? Not allow for the purchase of ultra-processed food through SNAP benefits. Glad to hear that we're on our way to that. That would be great. More strict school policies banning energy drinks, and soda in the school. Who do we have to talk to do that? What is the Blue Zone doing in other communities about fast food restaurants? Is there a way to, is it Emma? Yeah, Emma might be able to talk a little bit about that as well. So that would be good. And then utilization of apps to educate the public about what's being put in our food. MDs refer patients to home classes to receive the same messaging regarding healthy eating taught by registered dietitians. We know diets are not sustainable, but how can we make this a lifestyle by eating clean and healthy foods? Have physicians come through classes, have residents come through classes would be a great thing. So at least they're learning what we're talking about, and they're learning some things that maybe they could talk to their patients about. So that would be wonderful. Of course, cover these classes regardless of socioeconomic or health status. That's where, some of these classes are reimbursable by private insurance companies, but between Medicare reimbursement and private insurance reimbursement, 501c3 money, let these people come to these classes without having to jump through a lot of hoops. Provide ongoing support, utilizing health coaches, doing that, patients and communities, maybe host food prep parties where, we prep food for the week. Other things, I don't know if anybody's familiar with continuous glucose monitors. That's something I use a lot in my practice. It used to be only for type 2 diabetes. Now there's a Stelo CGM on the market. And I do push that for my patients to get it just because it gives you that immediate feedback. And so, I think sometimes we like to see things that are tangible. Diabetes is a silent disease, right? And so you don't feel a high blood sugar oftentimes. And so when you're wearing a continuous glucose monitor and you're able to see what a certain food does to your glucose, it's really eye-opening. And it really, I'll see patients, they'll come in and they'll see me, I'll put one on them for 10 days, and then they may be their time in range, which means their how well they're managing their glucose. It may be 20%. And then we talk about nutrition, they come back, and then it's at 99%. So we know that it can be reversed. We know it can. If you know better, you do better. And if anybody ever wants to wear a continuous glucose monitor, just let me know. I could put one on you so that you can experience that. And then require medical nutrition therapy on anybody that are on these weight loss drugs. There's a lot of people on them. Are they receiving education? Because, statistically speaking, when they go off of these drugs, they gain the weight right back, if not more. And that's what we're seeing. So, they need to have some lifestyle intervention before they go on these medications and during. All right. I didn't realize I did so much here. I'm sorry. I know we got to move on, but what can organizations do? Create a healthy work environment, provide healthy lunches. We've been doing that a lot here lately from our garden. We have a garden outside, so Tracy and I have been picking zucchini and squash and cucumbers. So our staff, we're trying to give it away. We actually have a little stand in the lobby where we give people free produce. It's wonderful, and people just grab it up just like that. So that's been nice to see. Also don't host unhealthy practices. We made a commitment when you went into private practice that we would not accept pharmaceutical dinners just because of the reason that they bring in not so healthy stuff and they're selling something, right? And not to say all medication's bad, but we didn't want to have that in our office every single week, and Olive Garden and Cracker Barrel and all of these things. So we provide lunch as much as we possibly can, and it's fun because we'll have potlucks at least once a week, and the staff will bring in something healthy because they know that we're all kind of looking at it together. And then, provide incentives for a healthy lifestyle. We talked about maybe offering gym memberships. Our staff around here walk around with IV poles attached to them when they feel dehydrated. So we do a lot of things here that we just let them, whatever you want, that's good. Put away the iPhone, turn off the television. I talk a lot to my patients about, if you're eating distracted, you're eating way too much. It takes a while for your brain to kind of calm down and feel like you're full. And so if you're eating in front of your computer, you're eating on the run, eating in front of the iPhone, that's going to be a problem. And then, eating at night, you wouldn't believe patients that say, I'll wake up at midnight and I get hungry, so I go eat a bowl of cereal. That's just terrible. You don't want to do that. So give your body time to reset. All right. So where do we go from here? Just real quickly, and then we can send these PowerPoint presentations out. But I really feel like these home classes, it's hands-on nutrition education curriculum. I don't know if the Blue Zone has a home program. They probably do, but I think we need to adopt or create one because basically what these do is it gives you a hands-on through food demonstrations, grocery tours. So we actually go to the grocery store with these people and we walk and we maybe scan things with the app. We talk about, the importance of fiber, all of those good things. But we also address food sanitation and safety, things that if you have a low immune system, you really need to know about. Basics of healthy food preparation. So just a real quick, so what that means is, again, impart knowledge and skills for safe food handling, especially for monitoring of like food temperatures, cross-contamination. Those are things that they would learn in these classes. Promote, again, a diet lower in sodium, sugar, fat, higher in fiber. How can we incorporate more fruits, vegetables, and whole grains? demonstrate label reading, getting the best nutrition for your dollar, and navigating food markets and restaurant menus for healthier choices. That would be something else that we could assist with. Assist in utilizing the nutrition apps, maybe have a resource for local farmers. I know Mud Hollow is really good. We get farm boxes from them on a weekly basis, and they deliver for free. So again, this motivates participants to become more active and effective in their own health care by enhancing self-efficacy through mastery in the kitchen. It fosters a therapeutic alliance. So they're seeing us as, you know, a partner to their health, not somebody that's preaching and saying, you need to do this and that, and, you know. And so it's really just a better way to teach somebody in a fun setting, and you don't feel like your blood pressure is going to go up. All right, I think that's it. Sorry, I went fast there. Any questions? Any comments?
You should join our statewide diabetes coalition.
Hey, sure.
Definitely be on that, because we're writing our strategic plan right now for the 5-year statewide strategic plan, and this needs to be incorporated.
Wonderful. Sure, absolutely. Yeah, yay. I would love to. That'd be great.
One of the hard things was I was talking to a principal a few months ago, and I said, I noticed y'all have a canteen, and the kids are all walking around with Red Bulls and chips and whatever. And I was like, is that the best thing for them to be eating? He said, no, but I make $1,000 a day. So as a school system, they're not incentivized to have health.
Yeah,
So I didn't guilt him over it because that's not helpful.
right.
He knows already, like,
Well, and that's it. I think we all know that it's a battle, because it's just like cell phones in the classroom. You know, how do we get them out when we've already opened Pandora's box, right? And so, you know, they try to ban cell phones. They started off really, really good at the beginning of the year. I didn't hear from my son all day long. And then by, you know, after Christmas, on there, you know, I mean, and so you just give up. You give up after a while. And so, you know, we have to make the kids want to do it. You know, we got to make drinking a Red Bull not cool. You know, we need to make water as what we, you know, and there are some kids that are, you know, health conscious, and I think it's happening, but it's just not happening.
There's some studies out there that show that if you put fruits and vegetables in front of toddlers, they will go for it preferentially over processed food. It's just that processed food is available.
yeah.
Right.
You know, and it tastes great once you get it in your system.
Well, and I think if you can only, you know, the problem, and my mom's an educational assistant at an elementary school, and she's like, you wouldn't believe the amount of waste, like kids don't even touch it. And I think, you know, if there was nothing else, like if there was nothing else, they would eat it. I mean, sorry, they would. I mean, maybe they wouldn't like it right away, but they would eventually eat it. Right. Yeah. Yeah. And so, you know, but again, I don't think the answer is just let's put healthier food in the school system without the education, because like I said, right now it's getting tossed in the trash, unfortunately. And so we just need to figure out a way to make kids want to eat it and parents to want their kids to eat it.
That's part of what this is trying to do. We're trying to close the loop.
Right.
Make healthy choice the easy choice, right? So if we can close the loop and get the state behind us, get the blue zone people to help us market it, get into the school systems, get into the gyms, get into the churches, get into everything, and tie everybody together.
Yep.
Then we got it. Then it is going to be
Thank
the easy choice. And I know we're in our infancy, but that's what
Yeah.
we're trying to do, and this is a huge part of it. And diet is a huge part of this whole thing.
Yeah. All right. Thank you guys. Thank you.